What do you do when something like this happens? So I'm going to start a series of videos talking to people about what to do in emergency situations. This is your cue to follow me and to share this video, because you don't know who the next victim is going to be. You don't know whether the next victim is going to be you. And if you share it to people around you, maybe then they will know what to do to help you. I'm sure that many of you have seen this video on social media. This woman was said to be in her office talking with her colleagues when suddenly she passed away. What happened to this woman is called a cardiac arrest. Cardiac arrest means that the heart suddenly stops working. And if that happens, it is not the time to start pouring water on the person or to start fanning them or shouting. Place the person flat on the floor. And after that, start what we call chest compressions. Don't open their mouth. Don't put spoon in their mouth. Don't pour water on them. Don't put garlic or onions in their mouth or anything. Don't do anything like that. Just place them flat on the floor. If you can remove their clothes, you can do that and start chest compressions. The reason you're doing chest compressions is this. The heart stopped working. And like I told you in one of my previous videos, the heart is like a pump. And because the body depends on its pumping as it is per second, the moment the heart stops pumping, the other functions will stop. By doing chest compressions, what you're doing is making effort to restart the heart and start the circulation of blood so that blood can pass oxygen and other nutrients to different parts of the body where they are needed. You're going to place your dominant hand over the other hand and lock it in like this. And then you take the heel at the wrist of this hand and place it over the sternum. In this video, you can see the sternum as that red part of the chest. The lower half of the sternum is where you're going to place your hand. You can use the nipples to recognize this part. You just place the hand in between the nipples and then you start compression. You don't waste time. You start immediately. You make sure that the movement, you straighten your elbows. You are not bending your hand at your elbows. You straighten your hand and make sure that the movements as you do the compression is coming from your shoulders. You have to make sure that the depth of your compression is about 5 centimeters. That's like half of the chest. So you are going to press really deep. And you're going to wait for the chest to recoil, that is, get back to position before you press in. But you're not waiting. You're not waiting. You're doing it not too fast and not too slow. You're making sure that you're doing about 100 to 120 of these compressions within 1 minute. So look at this video to see how fast it has to be and how not slow it has to be. It can be tasking. So if you have many people around, you can exchange positions. I mean, after one person does 30, then the next person should do 30 and then keep rotating it like that so that nobody gets tired. You continue to do that until help arrives. That's what the textbook says. But as Nigerians, we know that the help is not going to come because we don't have paramedics, unfortunately. If you have medical practitioners around you, if you have people around you that you can call, please call for help. If not, as you're moving this person to the hospital, keep the compressions going. And that's because the delays, by the time many people get to the hospital, the person is already dead. It will not be effective in all cases. It is not against you. If you do one, you would have done your best and it doesn't work out. I will encourage that parastatals and organizations, private organizations, government organizations, religious groups, all professionals to train people on some of these basic things. Anybody can do them as long as they have the necessary training, they have the necessary knowledge of how it should be done. And beyond that is the need for AEDs, defibrillators. There are now portable ones, and these are supposed to be everywhere, in schools, in hospitals, in gas stations, everywhere. In this kind of parastatal, government establishment, private settings, Everywhere should have them, but we don't even have them in some hospitals. I will encourage that we invest in something like this. They are automated, so immediately after you put it on, it will guide you through the whole process of using it. So it will tell you where to put the pads. It will tell you, it will analyze the heart rhythm, tell you when to do chest compressions, tell you when to move aside for it to apply shocks if it's a shockable rhythm that it gets. And let us use this opportunity to call on the government to put the right things in place to give us better health system. If you need more information, if you need help putting similar things together for people in your organizations, you can reach out to me and we can see how to get that started. Thank you for watching, and again, share this with others.